and welcome to this week's episode of Rating the News. I'm your host, Vanessa Otero. I'm the founder and CEO of Adfontes Media, and we produce the famous media bias chart that you may have seen online. Today, we're going to talk about one of our weekly topics, and this week, it's an exciting one. It's about free crack pipes. Did the Biden administration fund the distribution of crack pipes? It seems like a shocking headline, and we'll dive into the news stories that generated all the controversy that you might have seen on your social media feeds over the past week on that. In these episodes, we go through articles. We go through them in a similar way to how our analysts do them at Adfontes Media every day. We rate articles for reliability using factors like headline and graphic, expression, and veracity. We rate them for political bias using sub-factors such as political position, language, and comparison. So we'll go step by step through articles today from the right and the left and in the middle. And I'm not going to go through our entire methodology today. That's not what these episodes are about. But if you are interested in learning our full methodology, you can do so at our website, adfontesmedia.com. We have courses for individual members or folks that are in school. We have educational programs. So you can learn all about the in-depth mechanisms behind our methodology. Okay, but let's dive into the crack pipe articles. All right, let's go to I'm going to show you our ratings interface. This is what we use. It's a blank media bias chart with these individual sliders for headline and graphic, expression, veracity, and the bias sliders as well, language, political position, and comparison. So here's an article. The title is Biden Admin to Fund Crack Pipe Distribution to Advance Racial Equity. All right, what's that about? Here's an article in the Washington Free Beacon, and this article itself generated a lot of news. It sort of became news itself, but we're going to read this really closely to find out what's going on. Again, pretty dramatic headline. Biden admin to fund crack pipe distribution to advance, quote, racial equity. All right, that's our headline. Our lead says $30 million program will provide smoking kits, quote, smoking kits to vulnerable communities. All right, now we've got a picture. So we've got a picture of somebody smoking what appears to be an illicit substance. Let's assume it's crack or a similar drug with a metal pipe. So, all this together, taken just as is, conveys a lot, right? We want to compare the article to the headline once we're done reading the article, because if this is all you read just from the headline, you might have some impressions that are not exactly supported by the text of the article, are not exactly supported by outside facts, right? You might come away thinking that the $30 million is about funding crack pipes, and that giving crack pipes to racial minorities is the Biden idea's administration of funding racial equity. They sound all kind of objectively awful, right? So, but let's dive in. All right, so the Biden administration is set to fund the distribution of crack pipes to drug addicts as part of its plan to advance, quote, racial equity. All right, this is a stated factual as a factual statement. So our expression score would be high for it, like it's meant to be stated as fact, but is this actually true? Sometimes you have statements that are expressed factually, but the underlying veracity is not exact. It doesn't exactly line up, which is a big problem. So the $30 million grant program, which closed applications Monday and will begin in May, will provide funds to nonprofits and local governments to help make drug use safer for addicts. Included in the grant, which is overseen by the Department of Health and Human Services, are funds for, quote, smoking kits and supplies. That's in quotes. A spokesman for the agency, so the agency, the Department of Health and Human Services, that's HHS, told the Washington Free Beacon that these kits will provide pipes for users to smoke crack cocaine, crystal methamphetamine, and any illicit substance, right? We're going to get a lot of background on this story. So instead of just rating this one as is, we're going to read this one. We're going to read some supporting documents, and we're going to read some other articles before we make judgments here. Okay. So HHS, Home Health and Human Services, said the kits aim to reduce the risk of infection when smoking substances with glass pipes, which can lead to infections through cuts and sores. Applicants for the grants are prioritized if they treat a majority of, quote, underserved communities, including African Americans and LGBTQ plus persons, as established under President Joe Biden's executive order on, quote, advancing racial equity. Okay, so that executive order on advancing racial equity doesn't appear to be the same document that we're talking about when it comes to this particular grant. This is a grant program. Let's click on that to see what they're citing. Okay, a grant program. It's a big, long PDF document, 75 pages. Let's come back to that when we need to look some stuff up. This is an example of a primary source. It's the document at issue about this program. So whenever we can find a primary source, we want to do that. So it's good that this article linked to that primary source. Okay, so Democratic-run cities such as San Francisco and Seattle have distributed smoking kits to residents. So there are some citations here. So this is SF Examiner. Okay, so this is about SF group handing out free crack pipe kits expects to expand. All right. So that appears to be true just from the headline. In Seattle, they have distributed smoking kits, and in that smoking kit, well, let's dive into this a little bit. This smoking kit, it says SF group handing out free crack pipes expects to expand, but it says a renegade crack pipe distribution effort in the Tenderloin, in San Francisco, is entering its second month despite opposition from city, public health, and elected officials. Okay, so if you read this this article, it looks like this is not a government-run group or a sponsored group. This is a renegade. This is its own organization. It's opposed by city, public health, and elected officials. So it says Democratic-run cities such as San Francisco have distributed smoking kits to residents. So, not exactly accurate. The cities themselves are distributing them. Well, at least not San Francisco. But let's let that one slide. Okay. Some local governments, however, have in recent years backed away from their smoking kit programs over concern they enable drug abuse. Louisville, Kentucky, for example, allowed convenience stores to sell smoking kits, but later banned them. If you click on that article, that's about a local news story in Louisville, Kentucky. Just general substance of that is true. Legislators in Maryland ditched their distribution plan after facing backlash from local law enforcement and African-American leaders. Okay, so then they quote somebody here. They say, Sergeant Clyde Boatwright, president of the Maryland Fraternal Order of Police. Typically, fraternal orders of police are conservative organizations. So they quote a law enforcement officer here. So that could make this lean right. Also general dismay at a Biden administration program also can give you a hint that this already leans right. But this sergeant said government resources are better spent on preventing drug abuse rather than making it safer. If we look at more of a preventative campaign as opposed to an enabling campaign, I think it will offer an opportunity to have safer communities with fewer people who are dependable on these substances. Probably meant dependent, but that's the quote. So just against these kind of programs, calling them an enabling campaign. All right. Funding for the quote harm reduction grant program is provided through the Democrats' American Rescue Plan. So harm reduction is a term that we're going to come across in other articles. And it's in quotes here. And we might be able to read some bias into that, because harm reduction is a term used by folks that are for the distribution of materials, kits that make it relatively safer or reduce the harm to people who are addicted to drugs, even in cases where they cannot stop people from using the drugs. The harm reduction, comes from the idea that some people are going to continue to be addicted. We want to minimize risk of other diseases that they get in addition to their drug dependency. So, which the Senate passed along party lines after Vice President Kamala Harris cast a tie-breaking vote. Other equipment that qualifies for funding include syringes, vaccinations, disease screenings, condoms, and fentanyl strips. The grant program will last 3 years and includes $25 or $1. So that seemed like a pretty factual statement. These are things, so rated high for expression, high for veracity. If you look into that grant program, it does say that there are, that this is what is included in these grants. It says, an HHS spokesman declined to specify what is included in the smoking kits. So this is interesting because the spokesman declined to specify what's included in the smoking kits, but the title says specifically Biden admin to fund crack pipes, right? And here it says, again, distribution of crack pipes. And then it says, we'll provide pipes for users to smoke crack cocaine, crystal methamphetamine, and quote, any illicit substance. So this part that's quoted, this any illicit substance, because this spokesman, the spokesman for the agency, told the Washington Free Beacon this, I'm going to assume that any illicit substance is a direct quote. However, the rest of these will provide pipes for users to smoke crack cocaine, crystal methamphetamine. That's not a quote. So, there's here, because it says the HHS spokesman declined to specify what is included in the smoking kits, it's sort of unknown whether these kits actually include crack pipes, right? But this article certainly seems to imply that it does. Similar distribution efforts provide mouthpieces to prevent glass cuts, rubber bands to prevent burns, and filters to minimize the risk of disease. It is against federal law to distribute or sell drug paraphernalia unless authorized by the government. This last line, President Biden's son, Hunter, is a longtime user of crack cocaine. This one just makes me laugh because this, you can get the sense that because of certain bias clues, the strong, throwing the word crack pipe. I mean, crack pipe is a strong word, right? It really gets your attention. And they use it multiple times, and they have a picture of a crack pipe right here. So this really is a focus of the article. And the implication is that the Biden administration is giving away crack pipes. What is this last line in here for, right? Are they suggesting that first of all, it said he is a longtime user of crack cocaine, in the present tense. That's not necessarily true, right? The other thing is, did President Biden, think of this law by saying, who loves crack cocaine? My son. I love my son. I just want to give away crack pipes for everyone. That's a dig. That's a jab. This will go to bias because this is irrelevant. This girl will push it over for bias. But, this article created a flurry of coverage. And let's look at some of that other coverage. So let's reserve judgment on here. It seems like I'm not detecting anything that's necessarily false, right? Because it certainly seems that there could be crack pipes in these kits. Now, it says the HHS declined to specify what's included in the smoking kits. Well, we have that primary source, remember? Let's go look at that. Let's look at this program grant, and let's look up, anytime you need to look up a term in a big document, especially PDF, you can do Control F and look for it, right? So let's look for the term pipes. Okay, there are no results for the term pipes. Let's look for safe smoking. Okay, safe smoking kits and supplies. Oh, there's two references to it. Okay, so list and quantity of harm reduction materials purchased with grant funds, including but not limited to harm reduction vending machines, medication lock boxes, safe smoking kits and supplies, syringes, some other things. Okay, and the other reference to this says it somewhere lower, similar list. No reference to pipes. So whether it could include or not sure. Let's go to an article from the left, from the Daily Beast, that directly talks about this article. So this says, so Trumpland is like a category that this article is under, and it says, quote, free crack pipes myth rooted in false free beacon report. Interesting. So there are a few other things here. There's this subtitle, it says pipe dreams. This lead that says the Washington Free Beacon seemed to take a big leap to assert that the free crack pipes would be part of a harm reduction package. Conservative media lapped it up. And then this image, it says lies, 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 lies. All right. So we have some strong words here: myth and false free beacon report. And in the first paragraph, it said, earlier this week, a lie rocketed around conservative media that the Biden administration planned to hand out, quote, crack pipes as part of a $30 million public health grant package. The truth was just getting its pants on. So that's a phrase like a lie can travel around the world before the truth even gets its pants on. It says the myth appears to have started with a miscommunication and a large leap of thinking from the right-leaning Washington Free Beacon. So this is really interesting, like how both the Free Beacon and the Daily Beast couch their claims on what's true and what's a lie. It's really easy for people to categorize things as lies or as false, and mean that to say like that generally other like this not the actual claim was false, but the circumstances were misleading. So we want to really be careful, especially we want journalists, we want articles to be careful when they call something a lie or false, because that's really specific about inaccurate information. So they say that the myth appears to have started with a miscommunication and a large leap of thinking from the right-leaning Washington Free Beacon. So right here, they're not quite saying that the Washington Free Beacon lied, but here they do. They say it's a false report. All right. The Daily Beast confirmed that the claim that a Health and Human Services spokesperson confirmed that smoking kits funded by the program, quote, will provide pipes is false. The agency said the spokesperson never made or confirmed that claim, and it provided documentation to corroborate that version of events. All right, we're going to get real specific on the words and what these people mean in each of these articles. Okay, so the will provide pipes. That is a quote from here, from this Washington Free Beacon article. It says, will provide pipes. Remember, that part was not a quote, but they did make that claim. The Washington Free Beacon did make that claim. The Daily Beast said, all right, the report published Monday entitled Biden admin to fund a crack pipe distribution to advance racial equity, cited an HHS spokesperson as confirming that a sweeping harm reduction package will provide pipes to smoke, quote, any illicit substance. All right, included in the grant, which is overseen, so they talk about, the same quote. But an HHS spokesperson told the Daily Beast that the agency never said the kits would provide pipes. The spokesperson provided the email chain with the reporter, which matches the agency's account. All right, so HHS spokesperson saying, hey, we never said it was going to include pipes. So that seemed to be a leap from the conservative Free Beacon. But what did they say? According to the emails, the reporter never mentioned pipes. So the reporter didn't say pipes. The HHS representative confirmed that the reporter never asked about pipes in any communication. In the exchange, the agency provides the Free Beacon with a statement, which does not mention pipes and clarifies that all kits must comply with the law. In response, the reporter asked just to confirm these kits are intended to help users reduce risk when smoking crack and meth. And then the spokesperson replies, I wouldn't limit it to those two substances. It would reference any illicit substance. So here, they did say that the kits are intended to help smoking, crack and meth, and any illicit substance. So that's where this quote came from, right? Any illicit substance. Now, Daily Beast is asserting that this is a big stretch by the Free Beacon. Is it a big stretch by the Free Beacon that like these kits could include pipes? Let's find out a little bit more about pipes. Like the this document said it doesn't specify, right? So we're still like, there's still something unresolved here. So that response, which the report quotes, addresses the inquiry about risk reduction generally, not about pipes. So, they're focusing on this, like, are there or are there not pipes? An HHS spokesperson explained to the Daily Beast that, as you can see, the staff never said or confirmed that pipes were part of the kits. The spokesperson added that the reporter also admitted the information shared with him about the grantees needing to comply with federal, state, and local laws, the very language that would prohibit crack pipes. And so there seems to be like a logical argument, like the Free Beacon reporter should have used that language, that this information about grantees needing to comply with federal law to put together that crack pipes are actually prohibited here. Okay. But there is no actual prohibition in the text of the kits that say like pipes cannot be included so far. And so, there was an assumption by the reporter, maybe an opportunist, the Free Beacon reporter, maybe an opportunistic assumption to say, like, we didn't say they couldn't have pipes, so it's going to assume that we've got pipes in here. All right. Because crack pipes just is going to sell more, you get more viewers, get more readers, right? It's going to like strike at the heart of a culture war conflict. The statement reads in full: unsafe smoking practices can lead to open sores, burns, and cuts on the lips, and can increase the risk of infection among people who smoke drugs. Safe smoking kits have been identified to reduce the spread of disease. The proposal of using grant funds to purchase supplies for safe smoking kits must be justified by harm reduction program applicants as to how they contribute to preventing and controlling the spread of infectious disease in the harm reduction grant application. Harm reduction programs that use federal funding must adhere to federal, state, and local laws, regulations, and other requirements related to such programs or services. So they didn't include that information in the Free Beacon article, but the HHS spokesperson suggests to the Daily Beast that the Free Beacon reporter should have put that together responsibly to not overstate, the existence of crack pipes here. The Beacon report even cites that last line, noting that an HHS spokesman declined to specify what is included in the smoking kits, right? That's there in this article. Boop. And then that would seem to contradict the earlier claim in the same article that the agency also did specify included contents. These kits will provide pipes. So the Daily Beast is like getting into the weeds here, like we are, and saying like something that we noticed here, that they declined to specify what's included in the smoking kits. That seems to contradict up here where it says these kits will provide pipes, and like the whole deal here. Like from this picture, you're thinking it's going to include a nice metal pipe, all the kits, right? Because that's what the picture is of. All right, let's, they go back and forth a little bit more here. As of the publication of this Daily Beast article, the report has not been corrected. The story ran on Monday, the last day that nonprofits and municipalities could apply for a slice of the $30 million federally funded harm reduction package. The public health program, one element of a larger racial equity effort, would put some but not all of the money towards efforts to help protect people addicted to drugs from disease, infection, and inquiry. Conservatives criticize such programs as fueling substance abuse, but activists and many public health experts say these sort of programs provide a significant degree of safety and support to vulnerable people. We're starting to get a bigger picture of like, what all underlies like this grant program. While the HHS declined to specify any elements of smoking kits that may qualify, non-governmental organization Harm Reduction Harm Reduction International lists some typical items, including brass screen filters, rubber mouthpieces to limit burning, lip balm, and disinfectant wipes. Okay. But the kits only received passing mention as a bullet point in a 75-page plan. The document lists safe smoking kits and supplies among an array of possible items that applicants may propose to purchase with allocated funds. Other categories include, but aren't limited to, screening for infectious diseases such as HIV, et cetera, et cetera. There's a lot more stuff in a lot more detail. Okay, I'm still kind of left wondering, Do harm reduction kits like typically include pipes? Like, can they include pipes? Is that because I want to know, like, how big of a leap, how big of an assumption was this from the Washington Free Beacon? Like, I know it's a bias, like Washington Free Beacon article is biased to the right here. And this Daily Beast one is biased to the left, but like, you know, what I've read so far, it seems like some advocacy groups have distributed pipes as part of safe smoking kits. So Daily Bee cites a list and lists some things from there that says, including brass screen filters, rubber mouthpieces to limit lip burning, lip balm, and disinfectant wipes. So those seem like things that are not crack pipes that are in that list. What else is in this list? Okay, needle and syringe programs, drug consumption rooms, safer smoking kits. What can include these? Distribution of safer smoking kits, which can include glass stems, rubber mouthpieces. Let's see. So the use of improvised pipes can lead to lung damage. So, and the practice of using a layer of cigarette ash to suspend crack in improvised pipes. So, let's see. An alternative to support street forms of glass-based improvised pipes. Pipe distribution programs can also encourage safer drug shaking practices. So this list says you can have pipes in there. Like, you can. They left that part out in this Daily Beast article. That pushes the bias to the left, right? This is a little problematic here that they did not include that you could have pipes in these kits, right? Like, the thing that they cite said that, but they left it out. Okay. So predictably, they shift the focus. The report caught fire in conservative media, particularly on Fox News' Tucker Carlson show. The false claim was also amplified by a number of conservative figures and officials, including congressional candidates and officials, GOP members of the House committee and senators, including Ted Cruz, Marco Rubio, and Marsha Blackburn. So yeah, this did happen. Like, there's an incendiary article, like, polarizing, said crack pipes right in the beginning, even though that wasn't like necessarily clear whether they do or not, but they went with it anyways. And it said on Wednesday, both HHS and the White House shot down the claim that the administration would be handing out crack pipes, let alone $30 million worth. Fact-checking organizations and news outlets laid it to rest. So this is interesting. There was a statement the next day, or a couple of days later, maybe. So today, on the heels of organizations applying for grant money for harm reduction efforts, here's the statement. HHS and ONDCP are focused on using our resources smartly to reduce harm and save lives. Accordingly, no federal funding will be used directly or through subsequent reimbursement of grantees to put pipes in safe smoking kits. The goal of harm reduction is to save lives. The administration is focused on a comprehensive strategy, et cetera, et cetera. So they said no pipes. They didn't say like, oh, we never met pipes. The pipes have always been excluded. So to call the Free Beacon report false is a stretch, right? So it is a stretch for Free Beacon to say this includes pipes. It's biased for them to be like crack pipe 3 times in the headline lead and first few sentences, include a picture of it when it's not clear that crack pipes are in here, right? But it's also not quite. It's a stretch for the Daily Beast to call that false, right? Because these could have included pipes. Among harm reduction advocates and left-leaning organizations, this article here seem to think that this statement by Health and Human Services was a backtrack. Like, those kits could have included pipes, and now they said they don't. And they said it's like a controversy, and they were responding to misinformation and whipped up frenzy about these crack pipes, where in fact, there's arguments to be made why like having pipes is safer than other things. It remains to be studied. There's like a little bit more nuance in here, but progressive people and harm reduction advocates think this is a walk back. All right. So what do we make of all of this? When we're talking about rating articles, this one on the initial article itself, you know what, that's pretty, we're going to put the bias over here to hyperpartisan right, because like particularly with the dig on, on Hunter Biden right at the end, and then just like quoting the sergeant that's the head of the Fraternal Order of Police, language that implies negatively that this is a bad idea, bad program. But for reliability, we're going to put it in this problematic area. So it's not completely, it's a little misleading, right? Like if you didn't read it closely, right? If you didn't read it closely, you would think that maybe $30 million is being spent on crack pipes, or that crack pipe distribution, $30 million worth of it is for racial equity, right? And those are not quite the conclusion that you should draw. But the article is really careful about how they state it. So it's not misleading, but it is problematic. But if we look at this Daily Beast article, I think it's sort of the same, right? It's left leaning. They go in back to the they asked for a statement from the Washington Free Beacon reporter. So the Free Beacon, a reporter, denied any inaccuracies or contradictions. There is no contradiction, he wrote. We detail clearly what smoking kits are based on numerous distribution plans around the country. Grant recipients are able to purchase these smoking kits as stated in the notice of the funding. There is no notice of any sort of ban on pipes. And the HHS never mentioned this supposed ban on pipes to me in a statement before the story and for 2 days after. Okay. So they said that, this is what the Free Beacon reporter said, but here are our arguments why that was misleading. Daily Beast says, asked about the HHS claim that he never mentioned pipes. The reporter did not reply. After the White House pushed back on the story, the Beacon ran a follow-up, doubling down on the original claim. And then the reporter on Wednesday said that the Free Beacon stands by this report, right? So this language at the end, really specific about, how the Free Beacon reporter is defending their coverage and their assumptions. But very top of the article said it's false, like it's outright calling it false. So that's problematic too, right? It's also sort of misleading in a similar way, but it's over to the left. So for this article, let's go back to pretend this is this article, right? The Daily Beast article, that's going to be over to the left, focusing on the themes of, conservative media lying. And it's also going to be in the problematic area. Okay. So selective incomplete story, unfair persuasion. That's why it's in those areas. So what does the rest of the news media do with this, right? So you can kind of get the sense that on the right, folks ran with this headline, and on the left, there was an effort to like fact check the assumptions about like the broader story. So let's take a look at Snopes and Washington Post fact check articles. So Snopes is a reputable fact-checking organization. Said, did Biden admin fund crack pipes to advance racial equity? Says news reports in February 2022 grossly misrepresented the facts about a federal harm reduction program. So they call this rating outdated. This is an interesting one because their previous rating was mostly false, right? So that, but what were they calling mostly false? So there's a wave of misleading coverage, grossly misleading coverage. And what they cite here, that the editors note, the article has been updated after the Department of Health and Human Services stipulated that federal funding would not be used to include pipes in the safe smoking kits to be distributed as part of a substance abuse harm reduction program. As a result of that newly stipulated detail, Snopes has changed its rating from mostly false to outdated. So, so what happened was Free Beacon article comes out. And then there's a bunch of other coverage that sort of piles on from the right. Like we heard about the Tucker Carlson one, and they reference a couple other things here. It says on February 7th, Just the News published an article with the headline, Biden administration funding crack pipe distribution, saying it's needed for racial equity. That's misleading. That's more misleading than the Washington Free Beacon article. Like he didn't say we need $30 million, or we need to fund crack pipe distribution for racial equity, but that's what this headline said. So that's pretty misleading, more misleading than the Free Beacon article. And then Chicks on the Right went with headline, Biden admin spending $30 million so you have crack pipes, drug kits to addicts for advancing racial equity. Again, it takes like the most misleading parts of the Free Beacon article and then like throws them in the headline. So that's misleading. But they're calling this outdated because even if before it wasn't clear whether there's pipes or not, after the statement from HHS, it's clear that there's no pipes. So if they're still reporting this to generate outrage, then it's based on outdated coverage, right? But doesn't mean that the original reporting was necessarily wrong, like the Free Beacon reporting. The Washington Post says, no, the federal government isn't spending $30 million on crack pipes. And like, I don't know why they had to use a crack pipe as the picture here. I feel like that's also, it's just a clickbaity kind of choice. Not necessarily misleading because, I find this one more misleading because the article says like they are distributing crack pipes, and here like the headline is like, no, they're not distributing these crack pipes. Let's show you a picture. But they're attacking the claim of $30 million on crack pipes. That's not exactly the claim of the Free Beacon article, right? It's just addressing a broader misconception that's rooted in the original reporting. So like this got turned into memes on Facebook. Like, I can't believe the Democrats are funding crack pipes, like spending $30 million on crack pipes. Right. So a lot of the fact checks are not necessarily like as detailed as this Daily Beast, like going line by line on the Free Beacon article. And they're not necessarily debunking the Free Beacon article, but they're debunking, fact checking a broader misconception that's sort of based on this. Like if you took this and made it into a meme, then that part, there's not $30 million being spent on crack pipes for racial equity. Okay, so that's why does this matter? Why do we care about how memes and outrage gets generated and the accuracy of fact checks and the responses to the spread of misleading or problematic information. As we read through these articles, you might have got the sense that like this is a sort of a complex issue. Like all the problem of how to address address drug overdoses and drug addiction. That's a really complicated problem, and it requires research and study and serious approaches and trying things out and funding and support for people who are really suffering. And when those complicated issues get distilled down into like this binary us versus them, right versus wrong, like good versus evil, it detracts from our ability to like have serious discussions and come up with real solutions. Like if you make an immediate partisan assumption that like, the other side, in this case, Democrats like must be crazy because they want to give $30 million of crack pipes to folks. That's really misrepresenting the layers of complexity to the issue. And it's hard for people to come together because one side is just thinking, the right is thinking, Democrats are crazy. And on the left, based on this problematic Daily Beast article, they think that, there's no serious concerns that should be taken seriously from folks on the right. Like these issues on how to prevent drug addiction and how to best help people who are addicted are complicated and require people coming up with creative solutions that aren't so partisan. They require more serious discussion, not clickbaity headlines. All right, that's a story on crack pipes this week. Thanks for joining us, and we'll see you next time.